Mayo Clinic fired roughly 700 employees who failed to comply with the nonprofit medical center's mandatory COVID-19 vaccination policy. Joining us on the KOGO News Live line, Paul Seegert, a managing partner at PCS Advisors, a benefits consulting firm. Good morning, Paul.
Good morning. How are you today?
Good, thank you. So what do you make of this this firing at the Mayo Clinic?
Well, it's a little bit of a head scratcher because the industry, the healthcare industry, was in a staffing crisis before COVID. And then throughout COVID, we've seen more and more nurses, especially, leave the workforce. And we're headed toward a shortage of 1.1 million nurses around the country. And we've gotten to a point in this pandemic where we're firing some of those who almost certainly, likely have natural immunity or that kind of thing. And then we even have health, while they're getting fired, we also have health systems that are allowing vaccinated but COVID positive staff to work and treat patients. So we've gotten to a pretty interesting spot in our process of going through this pandemic.
So, in other words, you're saying vaccine mandates can really affect anybody's health care.
Absolutely. You have some hospitals around the country that, especially if you're in a more rural area, there are hospitals that are shutting down certain services because they don't have the staff to staff their facility fully. And COVID's had a big impact on that in many ways, not only burnout, but the vaccine mandates, the fact that then with the shortages that are a result, you can have that urban area can offer a traveling nurse to come in, and they'll even take more nurses from the more rural areas. So it's definitely worsened the problem. And I think that's why you've seen some very comparably reputable health systems like the Cleveland Clinic go away from the mandates.
So is there a solution?
Well, there's a health system in Ohio, I think, that had was taking a very nice approach to it, where they not only put in a mandate, but they said if you get tested and show you have antibodies so that you have natural immunity, they would accept that as one of their exemptions as a way to protect their patients, but also make sure they can staff their facility. And I think that makes a lot of sense.
All right, Paul Seegert, managing partner at PCS Advisors, joining us on the KOGO News Live line. Thank you so much.